Deep sedation is a type of anaesthetic that is given to you through a drip in the back of your hand. The drugs used in deep sedation will reduce your level of consciousness in a controlled way so that you are comfortable and pain-free, but you will still be able to be woken up. The reduced level of consciousness will only last a short while to allow the surgeon to inject local anaesthetic around your eye. Once the eye is numb, the sedative drugs will wear off so that you will be more awake and you can then cooperate with the surgeon's instructions.
When it is time for your surgery, a nurse will escort you from the ward to the anaesthetic room, which is next to the operating theatre. This is where you will receive your anaesthetic before going through for your operation. Here, an anaesthetic assistant will introduce themselves and check your details again. The assistant will help you to lie on your back on the theatre bed and attach some monitors to measure your heart rate, blood pressure and oxygen levels in your bloodstream. A small drip will be placed in the back of your hand in order to give you the anaesthetic drugs. The drugs will reduce your levels of consciousness in a controlled way so that you are pain-free and comfortable. This level of reduced consciousness is a temporary state to allow the surgeon to inject local anaesthetic around your eye. Once the anaesthetic has been given, you will be moved into the operating theatre on your bed for your operation. Once your eye area is numb, the drugs will wear off and you will be more awake so that you can cooperate with the surgeon's instructions.
You all right there, sir? Deep breaths in and out for me.
The anaesthetist will stay with you throughout the surgery to monitor you and make sure you are safe and comfortable. After your surgery, you will be taken to the recovery room where you'll have your heart rate, blood pressure and oxygen levels measured by a nurse. The recovery nurse will check that you are comfortable, not feeling too sick or drowsy before you go back to the ward. On the ward, you will have your eye checked and your final set of heart rate, blood pressure and oxygen level tests. You'll be given something to eat and drink. You'll also be given instructions on how to care for your eye at home after surgery and prescriptions of eye medicines and painkillers if you require them. You can then go home to make a full recovery from your surgery.